Hi, my name's Mel Considine. In this presentation, I aim to highlight some of the ways that I utilise social media in my role as a health professional. I will mainly be referring to the use of social media platforms like Twitter, Facebook and WordPress. So why should health professionals consider using social media? I've listed just a few of my ideas which I will cover in more detail in the following slides. The capacity to easily produce and widely disseminate information could be seen as a downside of social media, but I see it as a huge advantage and a great opportunity for interested professionals and students to engage in the sharing of information. Some wonder about how trustworthy the information may be online. Ultimately, it is up to the individual to critically appraise online information, just as they would with any other source of information. In fact, peer review on social media could be said to be more critical and rapid than via any other means. FOAM, or Free Open Access Medical Education, is one of the most exciting aspects of using social media, especially for isolated rural clinicians. You can access information or continuing professional development anytime, anywhere. And producing FOAM is a great way to brush up on my own knowledge. Here's just one of the videos I've produced on my blog at greengp.wordpress.com. WordPress is just one of the websites that you can actually start your own blog free of charge with a template. Social media is a fast, easy and cheap way to share public health information or alerts to a wide audience. And here are just a couple of examples of that. So there was a PAP Awareness Week in South Australia, and also Women's Day 2014, and there's a tweet there stating that social media certainly fueled the publication of Women's Day 2014. There are often grassroots advocacy movements and campaigns, and a couple are featured here, and these couple of campaigns really gained momentum due to the effective use of social media. Networking with colleagues is another benefit of social media, and again, especially for rural clinicians. There have been certain tweet chats that we can participate in, and this is with people all around the world. And I myself am involved in a Facebook group called GPs Down Under, where we can share ideas, comment on current medico-political issues, and share de-identified cases to discuss. And this is also a great way to start new friendships. Using social media to keep up with the headlines, research and medico-politics is increasing. However, as most people realise, social media isn't all rainbows and unicorns. There are some downsides, and social media addiction is one of them. It's important to always check your sources before posting via social media. It's good to understand that even if you delete a tweet or a Facebook post or a blog post, often this is searchable long after it's actually even been deleted. One of the main concerns that health professionals raise regarding the use of social media is the possible medico-legal risks, especially with regards to patient confidentiality and also to professionalism. There are social media guidelines and policies, and I've just taken a screenshot of the Australian Health Practitioner Regulation Agency's website, and they had some revised guidelines in March 2014. I like this 12-word social media policy because it's easy to remember. Don't steal, don't reveal, don't lie, don't pry, don't cheat, can't delete. Ultimately, it comes down to common sense. I recommend that you learn the basics first and do your research, but ultimately have fun.